Understanding autism symptoms and behaviors in children. Autism is a developmental disorder that affects the brains of children. Autism is often referred to as a spectrum disorder because it affects people in different ways. Some people may have mild symptoms while others may have more severe symptoms. Autism can affect how a person communicates and interacts with others, how they learn, and how they experience the world around them. Autism symptoms. Autism is a disorder that affects a person's ability to communicate and interact with others. It is often first noticed in early childhood and can continue into adulthood. Autism affects people in different ways, but it often includes difficulties with social interactions and communication, unusual responses to sensory input, such as lights or loud noises, restricted interests, and repetitive behaviors. Symptoms of autism vary greatly from person to person. Some common behavioral signs that may indicate autism include lack of eye contact, inability to speak, poor motor skills, unusual responses to sensory input, for example, loud noises, repetitive behaviors such as rocking back and forth or hand flapping. The importance of identifying autism early. Autism spectrum disorder, ASD, is a developmental disorder that affects the way a person communicates, interacts with others, and how they experience the world around them. The condition can range from mild to severe. It is important to identify ASD early because it can help people with ASD get the care and support they need to thrive. The symptoms of autism spectrum disorder, ASD, vary from person to person. Autistic spectrum disorder treatment options. What are the most effective treatments for ASD? There are many treatments for ASD, and the best treatment for a person depends on their needs. The most common treatments are behavioral therapy, medications, and educational interventions. Behavioral therapy may include social skills training, speech and language therapy, occupational therapy, and physical or speech therapies. Medications may be prescribed to treat symptoms of autism such as anxiety or depression. Educational interventions may include special education programs in school or tutoring programs outside of school. Conclusion: the key to understanding autism is acceptance. Parents and teachers are often confused about how to teach children with autism. They don't know if they should be more accepting or more strict. There is no one-size-fits-all approach to teaching children with autism. The key is to find what works best for each individual child and their specific needs.